Good afternoon, and thank you for joining us for our first COVID-19 briefing of 2021, which is also our 100th briefing since the pandemic began. And thank you, of course, to Margie Prop for providing interpretation once again. Today, in addition to an update on current local conditions of the pandemic, our briefing will discuss local vaccination efforts. Health Director Pat Lopez and I are pleased to be joined by guests from Tabitha, the Nebraska Healthcare Association, and CHI Health St. Elizabeth, who in just a few moments will share more about their efforts to care for our community and keep people safe during this pandemic. The good news on all of our minds, of course, is that we begin this new year filled with a great sense of hope that our collective efforts and new vaccines have the potential to put an end to the pandemic this year. The first doses of vaccine arrived in Lincoln just 3 weeks ago, and while supplies are still very limited, we have made really good, substantial progress vaccinating community members in Phase 1A. Hospitals have been hard at work vaccinating frontline healthcare workers and primary care physicians, and they hope to finish the first rounds of those shots soon. Our own Lincoln-Lancaster County Health Department has finished administering the first round of vaccinations for our city and county emergency medical technicians. We are also pleased to be able to share with you that we are making progress in this vaccination phase beyond physicians, healthcare workers, and EMS professionals. Vaccinations are now underway for residents and staff of some local long-term care facilities. And the residents are some of the most vulnerable individuals in our community. In addition to the health threat, these residents have also been isolated from family and friends for much of the year. And to tell us more about what these vaccinations mean for these residents and those who care for them is Christy Hinrichs, Tabitha's president and CEO, who is joining us now by Zoom. Over to you, Christy.
Thank you, Mayor. It's great to see everyone. Happy New Year. Like to just kick off by just expressing gratitude to you and to Pat and her team just for the no-nonsense, really diligent approach that you've taken to the COVID protocols. It has certainly helped us along the way, and we have appreciated the collaboration and partnership. As you mentioned, hope is probably just one of the best words to describe how we're feeling. We were excited to be part of COVID-19 history last week as we began our first vaccination clinics. In the first week, we were giving about 800 doses, and that's a combination of both our residents and our team members that we have been blessed to care for and about and help us do that work. We anticipate our second clinic for second dose of the Pfizer vaccination to be the third week of January. And at that time, we'll also give first dose of the remainder of our team members and any additional residents that may not have made it to the first one. About 95% of our residents were vaccinated this first round. We anticipate that by the end of the second round, we will have about 75% of our team members who will have been vaccinated. So again, I guess just describing where we're at today is really hope-filled. People were excited and grateful. I think those are just so many common terms that we heard. And I think the thing that you pointed out, Mayor, that's just so important is this was not just physical health and a strategy to kind of get back to some sort of normalcy, but we're excited to bring seniors back together with their family members. And so we were excited to hear the governor announce that maybe in just a few weeks that those 75 and older will begin to have vaccine available to them. We're excited for the full rollout and just encourage everyone to consider being vaccinated because many family members have not been able to embrace their loved one who lives in a community like Tabitha since nearly a year ago. And so the idea of reuniting them is just very exciting to us. So we're appreciative that we had great success in partnering with Community Pharmacy, who came in and rolled things out without any glitches. We look forward to continuing to collaborate with public health and health and human services and the pharmacies to provide additional vaccines to community members as they need them, whether we're a site or whether we're assisting in providing the vaccinations. We've appreciated being community collaborators to provide support for those with COVID, both in our buildings and in the community. Just proud to live and work with you. Feel like we're doing a great job getting seniors back to having reunions, I guess. We will also provide on our website so that there's additional access to seniors and their families as you have updated vaccination information on where and how. We'll put that on our website at tabitha.org/VAX for access as well. So pleased to be a part of it.
Thank you so much, Chris, for your leadership and for the great work that you're doing at Tabitha for so many in our community. Hope, togetherness, reunions, gratitude, excitement. Those are wonderful words to be able to share with our community. So thank you for being here today to do that. We really appreciate you. Next, I am really pleased to introduce another person for whom we are grateful for his service to our city and our state. Heath Bodie, President and CEO of the Nebraska Healthcare Association, also joins us today. Heath and his team have worked closely with long-term care providers across the state throughout the pandemic to advocate for and support them. And he's here to speak further about vaccination efforts underway at long-term care facilities in Lancaster County. Over to you, Heath.
Well, Happy New Year, Mayor. Thank you so much for having me today. What an honor. I absolutely love the joy I hear in your comments and your voice, and that I see in Christy's face. It is, frankly, a bit of a different time than we've experienced for the last 10 months, where we all felt like there was more gray than light. And this indeed is a good day and a good time that's in front of us. I just want to take a second, much like Christy started out with my gratitude for you, Mayor, and for your team at the Lancaster Health Department. I have had a great privilege to work closely with Pat Lopez and her team to be a bit of a communication conduit, if you will, as the providers have worked through the issues of the pandemic some time ago, PPE and other things, and now with vaccine. And, Pat is a first-rate leader, and she has first-rate folks around her. And I've just been so pleased. I mean that genuinely. I get the opportunity to connect with the Lancaster providers once a week, and I tell them often, we're privileged here. It is not every county that has, or not every health area that has leadership and direction like that. So thank you, Mayor, and thank you to Pat and her team. Well, this is this is what we've been waiting for. And while it is the biggest undertaking I could have ever imagined, I have a bit of a military background before I got into healthcare, and there are lots of similarities with communications and things, with huge undertakings in that world that there are in this. But we're doing really well. And Lancaster County is absolutely a poster child in my mind for things going well. We have many vaccinations that have happened. We did a quick little straw poll, and we're able to capture the thoughts of about half of the county's providers today. And about right at half of those folks have already had vaccination clinics for the first round. And most of the rest of those, again, the ones that I was able to catch just today, have their clinics scheduled. I don't know anyone that doesn't share the joy that you saw in Christy's face and in her words, that this is such a hope-filled time and so much gratitude. And so for that, we're highly appreciative. People may realize Christy talked about a pharmacy called Community Pharmacy. We also had partners from on a national level with Walgreens and CVS. And so they all had little different pieces of the vaccination plan. Of course, your team, Mayor, over at Lincoln Lancaster Health Department will have a piece of that for some of those providers as far as vaccinations. And then Christy laid out as it rolls forward with 75 plus. Like anything, there's been a few little hiccups. And I think the part I appreciate the most is that we're trying to work through those together. But the absolute good news is that, and Christy put it so well, this is the light at the end of the tunnel. This is our way out. And I would just really encourage, as we may have healthcare workers listening, as we have citizens of our county listening, to highly consider taking this vaccine. I realize it's not indicated for everyone. There is plenty of good information out there to help people understand put to bed most of the myths that are focused around getting vaccinated. And again, I'm a realist. I understand it's not for everyone, but it is part of our way forward, our part of getting to whatever our new normal looks like. And so, Mayor, I appreciate you offering me the opportunity to weigh in today. And thank you so much for your leadership and your team's support with nursing facility and assisted living providers throughout this pandemic.
Well, thank you for your kind words, Heath, and for everything you're doing to help keep our loved ones safe and healthy. And this really is, you mentioned the word unity, is so much unity that is awe-inspiring to see as we come together to try to put an end to the pandemic. So thank you for your vital role in that. Since the beginning of the pandemic, we have known that our older residents and those with underlying health conditions are more at risk to develop complications from COVID-19. Advances have been made in treatments that can help those with COVID-19 avoid severe illness. And one of those advances is called monoclonal antibody treatment. And joining us today to talk about its use and benefits is Dr. Michael Rapp, President of Medical Operations for CHI St. Elizabeth. Dr. Rapp will also update us on what the hospitals are experiencing right now and why we all need to do our part to continue to protect our healthcare system. Thank you so much for being here today, Dr. Rapp.
Thank you very much, Mayor. I very much appreciate it. And I wish to echo that one of my favorite parts, perhaps the only favorite part of this entire ordeal, has been getting to know Pat Lopez as well as I have over the last few months. So again, Pat, I wish to echo what everyone else has said about your leadership and yours as well, Mayor, throughout this. This has been an ordeal that I would never have believed I would experience as I near the end of my medical career. Specifically, Pat and the Mayor have asked me to talk about a new treatment that was released just before Thanksgiving to allow an additional method of treating COVID-19. And these are monoclonal antibodies. Monoclonal antibodies are blocking antibodies that are designed to bind to the spike protein, which are the little things when you see an example drawing, they're the part that stick out from the body of the virus. They have been released under an emergency use authorization by the FDA for high-risk patients. They can be from age 12 up and up. They have to weigh at least 40 kilograms. High-risk patients are those of any age that have a body mass index of greater than 35, have chronic kidney disease, diabetes, or immunosuppressive disease, or are taking immunosuppressive treatment such as steroids. Also, anyone over age 65, no matter how healthy they feel, qualify for this. Anyone over age 55 with cardiovascular disease, hypertension, or chronic obstructive pulmonary disease or other chronic respiratory illnesses such as asthma. These monoclonal antibodies are designed to keep people out of the hospital. They are not designed for people in the hospital. If you are hospitalized, you will receive a similar therapy in the sense of it being convalescent plasma, which would have antibodies to this disease within it. So you need, if you are diagnosed with COVID-19, you would have 10 days to receive this treatment as long as you stay out of the hospital. So if you are diagnosed with COVID-19 and you are in one of these high-risk groups, you should have the conversation with your physician as to whether this treatment is appropriate for you. Now, early on, to be honest, this has been underutilized by the medical community, despite the efforts of Pat and the health department, as well as myself, to get this information out it has been slow in picking up the level of treatment that we would desire. Having said that, the last 2 days, we have been blessed with a large number of referrals, of which we are now catching up on as quickly as we can, and even expanding the size of the, and I have to say the name slowly, banlanivimab is the name of the monoclonal antibody that we have. We are expanding the size of the lab as we speak. That's what I have on the monoclonal antibody therapy. Did I leave anything out, Pat? I didn't even think of. Okay. And then the mayor has asked that we discuss the status of the hospital and basically medical community. Over Thanksgiving, the entire hospital system in Lincoln was nearing our capacity. I don't think either institution, either Bryan or CHI Health St. Elizabeth, reached our capacity, but we were worried. We were working very hard. People were picking up extra shifts. You could see the strain in everyone's face. And again, thanks to the leadership, I believe, of our local community, the banding together of all the physicians, of the health department, the messages that were sent out in commercials and on the news, we seemed to do quite well over Thanksgiving. The number of cases in our hospitals has decreased, but I'm still, as is everyone, extremely nervous as to how our population did over the last holidays. And that will be determined in the next few days. We have not returned to our pre-Thanksgiving levels in the hospital. So if we get another, what I would call wave or surge, we will again be very, very stressed, and we will be communicating that out to everyone. But right now, I'm pleased to say, while we're very busy, we're doing okay in our hospital systems. As for CHI Health St. Elizabeth, I can't help but put a shout out to the remarkably dedicated healthcare workers. In our lowest level, we have the Test Nebraska Laboratory turning out over 4,000 tests yesterday, almost 1,000 tests for Lancaster County alone. Just yesterday, those are being turned around in 24 hours or less, which is better than almost anywhere else in the nation. On first floor, we're vaccinating for the second round with the Pfizer vaccine for our very frontline healthcare workers. Those who are seeing COVID every day are getting their second round of vaccinations. And then, of course, our monoclonal laboratory is also on the first floor. And then upstairs, nothing but pride for our staff, everyone involved in the hospital, for their dedication for taking care of all of our patients. So thank you to everyone. Thank you, Mayor. Thank you, Pat, for your leadership, and especially thanks to all the healthcare workers throughout the entire city.
Thank you so much, Dr. Rapp, for the work that you are doing at St. Elizabeth and for taking care of our community members. And all three of our guests today are part of our local community COVID-19 Vaccine Advisory Committee, which has worked closely for months with our health department team and several other partners so that we can rapidly administer the vaccine. And while the vaccine is not yet available to the general public, we do urge each of you to get the vaccine when it becomes available to you. Getting the vast majority of people to be vaccinated is vital in order to bring about an end to this pandemic. So until it's our turn, keep in mind that we all still have a vital role to play in stopping the spread of the virus and preventing people from needing hospital care, as Dr. Rapp mentioned. We remain deeply grateful to all those who are doing their part to keep themselves and others safe. Please continue to be diligent about the 3 W's. Wash your hands often, wear your mask, and watch your distance, avoiding close contact with others from outside your household, as well as avoiding crowded places and confined spaces. The commitment of our community to these proven strategies matters. Time and time again during this pandemic, close to Thanksgiving, as Dr. Rapp mentioned, when we have asked for your best efforts to fight the virus, you have answered the call. And even as this vaccine brings so much hope, now is not the time to put your efforts on hold. As you will hear shortly, some of our indicators, unfortunately, are headed in the wrong direction. We're particularly concerned about our case counts and the rise in our 7-day rolling average number of cases. These are among the factors that keep the COVID-19 risk dial in red for the 9th week. Health Director Pat Lopez is here with more to share about our indicators and information regarding the vaccine.
Thank you, Mayor. We are encouraged by the high level of interest in the vaccine, and we hope that continues in the months ahead as our vaccine supply increases in Lincoln and Lancaster County. So far, we have received about 9,800 doses of the vaccine, and about 7,400 doses have been administered. And here is where we are right now. Vaccinations continue for those individuals in phase 1A. As the mayor said, the first round of doses for emergency medical technicians is now complete. The hospitals, as well as Lincoln Surgical Center and Blue Stem, are vaccinating healthcare personnel and hope to finish giving the first doses very soon. Some healthcare personnel and EMTs are already receiving their second dose of vaccine, just starting this week, yesterday. And I believe Brian started on Sunday. As the mayor and our guests discussed today, vaccinations are underway for residents and staff of some of the long-term care facilities. These vaccinations are being conducted through a program that partners long-term care facilities with participating pharmacies that coordinate the on-site vaccination. Our health department is also assisting with vaccinations at a few facilities that do not have a pharmacy partner, and those should be initiated later this week. This safe and effective COVID-19 vaccine is providing a critical layer of protection to those vulnerable residents and the committed staff who care for them, as you heard from both Heath and Christie. In the near future, vaccine will also be available for others in phase 1A, including home health and hospice care providers, as well as school nurses, dentists, dental hygienists, and dental assistants, to name a few. Keep in mind, vaccine arrived in Lincoln just on December 14th, barely 3 weeks ago. We've accomplished a great deal in a short amount of time. A successful vaccination program requires a team effort, and I want to thank all of our partners for the continued commitment to this community and their support. They have all volunteered to their own staff to make sure our community is taken care of. And as I said, that's Brian, CHI Health St. Elizabeth's, Lincoln Surgical Hospital, and Blue Stem, as well as many others who have volunteered. Many have volunteered to work weekends and after hours to keep vaccinating those in phase 1A. Some clinics were conducted on Saturday, and they've been early in the evening. And we are extremely grateful for those staff who are donating their time and resources to assist our community. A vaccination campaign of this scope is large and a huge undertaking, and we still have a lot of work ahead. We're assessing the number of people in phase 1A who still need to be vaccinated. Once those doses are available, individuals in those groups will receive vaccine. Due to the limited availability of the vaccine, the federal government and the state provide recommendations on who should be offered vaccine and when. As we get closer to phase 1A, we'll start with phase 1B, which includes, many of you have heard, people who are over at the age of 75 and other essential workers. The state has not yet announced the start date for phase 1B, but we are actively working on that portion of our plan, and we will provide more information at a future briefing. The state has announced that it will be introducing a website in coming weeks for citizens to register for vaccinations. As they develop their system, we will be working with them to determine what role that will play in our plan. That website is not available yet, and registration is not available at this time. But just to assure the community, we are already working with our community primary care providers and talking about those over 75, along with other partners. And as I said, vaccine is not yet available to the general public, so we ask for your understanding and patience as we move forward. We continue to work with community partners on potential locations for public vaccination clinics. Multiple sites are being considered, as I mentioned before, but no final decisions have been made. We are looking at what is best for our community and those receiving the vaccine. We will make public announcements when there is enough vaccine to start public clinics. The goal will be to vaccinate as many people as we can as soon as possible. In the meantime, we will continue to provide updates during these weekly briefings. You can also find the latest information at covid19.lincoln.ne.gov and through the COVID-19 hotline at 402-441-8006. For the time being, please keep protecting yourself, your loved ones, and the community by wearing masks, watching your distance, and washing your hands, and avoiding crowded places, close contact in confined spaces. In December, we began to see an improvement in many of our local data indicators. However, during our last briefing, we shared some concerns, including a decrease in the people getting tested, the high positivity rate, and a recent uptick in hospitalizations. This past week, we have continued to see indicators moving in the wrong direction. After peaking at over 2,100 new cases the week ending December 5th, we saw a decrease in case numbers around the rest of the month. However, we are now seeing an increase from 925 the week ending December 26th to about 1,200 the week ending January 2nd. The 7-day rolling average of daily new cases also shows the decline in December and the recent increases from an average of 132 cases on December 26th up to 166 cases on January 3rd. Access to testing is widely available in Lincoln. However, we continue to see the number of people getting tested decline locally and across the state. If you have symptoms of COVID-19, please get tested and isolate yourself from others. Identifying positive cases and close contacts is critical to preventing the future spread in our community. The good news is that testing turnaround time is the best it has ever been. In most cases, you can expect your results within 24 hours, and sometimes much less than that. Our positivity rate also dropped in December from 34% the week ending December 5th to 26% the week ending December 26th. However, this past week, the rate was back up to nearly 34%. This is an indicator that the virus is still well established in the community. Lincoln Hospital capacity also shows the same trend, down in December and now heading back up. The number of COVID-19 patients hospitalized locally declined from a peak high of 177 on November 29th down to 83 on December 24th. We are now back up with 100 local hospitalizations today. 65 of the patients are from Lancaster County and 35 are from other communities. On the 7-day rolling average, the orange line represents the 7-day average of new cases, and the blue line represents the 7-day rolling average of local hospitalizations. You can see the decline during December and the recent increase. Hospitals are still moving forward with caution, and they continue postponing some elective surgeries to maintain capacity. Sadly, we lost 74 members of our community to COVID-19 during December, and so far this month, we've lost 8 residents. Those 682 deaths are more than half of our community's 161 deaths for the entire pandemic. We extend our deepest condolences to the family and friends who have lost loved ones to this virus. In looking at our comparison chart, it clearly shows why we continue to be in red on the COVID-19 risk dial. It compares the key indicators from the last full week we were in orange in October to our indicators at the end of this past week. The 7-day rolling average of new daily cases is up from 127 to 171. The weekly case count was 890 at the end of October. At the end of last week, we were at 1,200 weekly cases. The weekly positivity rate was at 18%. It is now very high, as I said, near 34% at the end of last week. Finally, the 7-day rolling average of COVID-19 patients hospitalized locally was at 75 at the end of October, and at the end of last week, we were up to 98 patients. Again, as we've discussed, the red on the risk dial signifies that the risk of virus spreading in our community is severe. If you attended a holiday gathering and you have symptoms of COVID-19, it's very important that you get tested now so you can identify the close contacts and prevent further spread. We need everyone to continue to limit contact with those outside of your household as much as possible. Older adults and those with underlying health conditions and others at-risk populations must be especially careful. Stay home, rely on help from family or friends for needs outside the home, and distance yourself from household members who work outside of the home. Only visit businesses who are participating in activities that follow public health guidance. Be diligent in following the 3 W's. Again, wear your mask, watch your distance, and wash your hands. And avoid the 3 C's, crowded places, confined spaces, and close contact. We have demonstrated before that our collective actions can improve our situation. The choices we make today will impact the spread of the virus and the number of cases and hospitalizations we will see in the next few weeks.
Thank you, Director Lopez. Many in our community continue to have questions about the virus and about the vaccine, and we want to remind everyone that a great deal of information can be found at covid19.lincoln.ne.gov, our website. You can also see at that website a link to the state dashboards, and the state vaccine dashboard shows the statewide data for total vaccines distributed to the state and administered to our public, as well as the percentage of the population age 16 and over that has been vaccinated. We also want to remind you that the new Recover LNK website is now up and running, and that's a place where you can find information on how our local businesses are taking precautions to protect both their employees and their customers. And again, that site is recoverlnk.com. And with that, we'd be happy to open this briefing up for questions from the media.
Riley Johnson from the Journal-Star.
Hi, Riley.
Happy New Year. I have a question for Director Lopez.
All right, she'll be right with you.
Hi, Riley.
Hi, Director Lopez. Happy New Year. I wanted to ask about the positivity rate, particularly, it seems Lincoln, Lancaster County, and Douglas County have, in the last few weeks, had pretty high positivity rate, especially when compared to the overall state rate. What do you think is driving the numbers here? And you mentioned testing. Do you think people are just not getting tested who may be borderline or almost asymptomatic? Or what do you think is driving those numbers to be as high as they are?
You mentioned Douglas County, and I also know there's a couple of our other health districts that are experiencing the same thing. But in general, we know that people are going in when they're symptomatic, and maybe perhaps, our flu numbers are down, our RSV, another virus, a respiratory virus that occurs, those numbers are down, which is all really, really great. But we also know that a lot of people had holiday plans. Scientifically, Riley, I can't explain all of that, but we also know that some people really didn't want to get tested right before the holidays. So now we're starting to see more of an uptick again, as you've noticed in our numbers. But we just have really still a great deal of community spread in both Douglas County and Lancaster County. That remains a concern. And we can see that too in our hospitalization numbers starting to increase.
And a follow-up to that, there's more prevalent at this stage in the pandemic. There's more prevalent rapid testing. Are all of those results, the negatives that rapid tests are producing, are they all being reported to the county health department as best you can tell?
We really work very hard with everyone that is doing rapid testing to report that to us, and we also work to make sure that the results are accurate and appropriate. And so, yes, Riley, we request all of those test results, the positives and the negatives, and some of the places aren't connected to the actual uplink into the state system, but they do send us reports, and the state will help facilitate getting that data in, especially when we're dealing with high caseloads.
So as far as you can tell, no concerns of underreporting for rapid results?
Not that we are aware of. There's a few more offices that are doing testing, but we've worked really closely with them. And I have to say, all of our physician offices and other providers in the community, some at first weren't quite on the same level, but everybody understands and they all want to report positives right away. But we also wanted to get the negatives in as well.
Director, this is Brent with Channel 8. You mentioned the flu numbers are down. It seems to be the case everywhere. Some people are suggesting that that's just because it's being misdiagnosed as COVID. Can you explain why we might be seeing such little flu activity?
Well, it's hard to misdiagnose flu as COVID when you do a test. They're separate tests. And for example, some of our labs are actually doing flu testing at the same time they're doing COVID testing. And the reason, I think, Brent, I mentioned before, other countries that have gone through this season, passed through the time when influenza is more prevalent, have also seen a tremendous decrease in numbers. And those are countries where there was mask wearing and the idea to watch your distance and wash your hands were in place. And that's probably the biggest thing. And if you think back, it's hard to remember almost a year ago, but during flu season, we were telling everybody to not maybe specifically says watch your distance, but we were telling people that in essence and really washing their hands and not to go in when you're ill. So some of those same practices are the same things that we're looking at now, and I really think it has made a tremendous difference. There's a lot of studies that have been started, so we'll keep you posted.
On an unrelated note, I know it's pretty early on, still in phase 1A, but what discussions have you had with LPS about vaccines and whether they might be required for students and staff? Is that a discussion that you and the health department have had with them yet?
Well, that's a really great question. Thank you for asking. Actually, we've been working not only with LPS, but all of our schools in Lincoln and Lancaster County. And we actually have surveys out of which staff are in which areas, getting a general idea of the desire to have vaccination. I think we reported, the numbers are really high, over 86%. That seems to be fairly prevalent from all of the educators and staff at the schools. We're looking at those 16 and older and what they would need. But those are areas where they would need parental permission, and so we're working through part of that. But yes, we're ready. We're being prepared to move forward as soon as we have vaccine.
And real quick, who would, I guess, have the authority to make that a requirement for students? Would that be the health department, the state DHHS? Who would have that? The districts themselves?
The districts themselves have authority to require. Vaccines go through a process of approval for how they're required. So it would take a process, and some vaccines are required, as you may know, Brent, by statute, and that would be kind of the same thing. We're just hoping at this point, just from the tremendous positive response we had, we see that a lot of those educators and administrators and staff are going to get vaccinated.
Pat Riley with the Journal Star. I had a question noting how sort of sensitive the vaccine can be to temperature and the requirements for ultra cold storage. Has there been any issues in maintaining or preserving the doses, or any waste of the vaccine as of yet?
You know, that's another good question. Actually, Riley, we've had no waste of the vaccine whatsoever. Every dose has been administered. We keep a list of potential individuals that we can call at a moment's notice that may need the vaccine, but it happens really rarely because at this point, the groups that we're working with are specific groups, and so they're scheduled, and those that are scheduled always turn up for us to provide the vaccine for. We haven't had any problems with storage. One of our providers in the community received some vaccine that some of the storage and shipment had been a problem, and so those doses were replaced by the manufacturer. But other than that, our hospitals have not had a problem in doses they've received.
This is Bailey Bischoff with 1011. You know, we've gotten a lot of comments from people saying, why is Lancaster County still in the red while the state is in their blue zone with very few restrictions? What would be your response to them saying that, you know, we're just staying in the red for too long?
Well, I think, you know, all the numbers that we just went over, the state's blue zone is based on one factor and one factor alone, and that's hospitalizations. And that has not been the only factor our health department in our community follows, or any health department across the entire state. We need to look at the number of cases we have. We need to look at the positivity rate, just to name a few, in our hospitalizations. So if people feel that the state's moved to the blue zone, that's based on one factor alone, and it's hospitalizations.
Any further questions from the media? If not, I just want to say thank you again to our guests today for all of their work to keep our community safe and healthy. And thank you to you for tuning in to find out ways you can participate in protecting yourself, your loved ones, and our community. Thank you, and stay safe.